Okay.
Hello, the YMCA education series is free and open to the public. We encourage you to spread the word and invite your friends and families to come join us. We host approximately 6 to 8 of these a month and all types of different topics. This program will last about an hour. You may have questions. If you want to hold your questions towards the end, we will have a time for specific questions. But if you have a question a burning question, feel free to put it into the chat box and I'll make sure that our speaker, Alyssa, will be able to see that. Otherwise, try to hold them to the end. Thank you again for joining us today. I would like to introduce you to Alyssa. Okay, and then from the Family Service Center, and talking about navigating a mental health maze, and a clinician's perspective on the mysteries of the mental health system. So for those of us that are trying to find a mental health care provider and it seems like a huge thing, hopefully we'll get some more great advice today. So with that, I would like to welcome Alyssa.
Hello, thank you, Pam, so much. I was so looking forward to being here, actually. So I wanted to welcome you guys, and whoever watches this on YouTube, I welcome you as well. And, you know, I expect you guys have joined me today because the issue of mental health has touched your life in some way, and you need some kind of direction. You know, how to start from A to Z. And so I'm here to tell you, give you some little hints too, as we go along. So I applaud you guys for being here. You know, this is a very important topic. And it's just that the mental health system is difficult and challenging to navigate. And I should know because I am the mother of 2 children who have mental health issues. So I have tried to navigate, and I am a mental health clinician. So there you have that. I've been on both sides. You know, mental health struggles were common before COVID-19 pandemic and has, of course, they've escalated since. Actually, there's been a 25% increase in prevalence of anxiety and depression worldwide. That's 25%, that's huge. A road to recovery does indeed exist, and I'll offer advice on how to travel that. So today's goals, that is me. What is mental health anyway? I'm going to put this at the end, and the video will just kind of encompass everything we talk about. It's very cute. So today's goals are to describe facts about mental health, and then we will demystify fears and shame that surround this subject. And finally, I'll direct you in the right direction in order to receive the help that you're looking for, whether it's for yourself or a family member, for a friend, whomever. Describe. So there are sobering statistics we'll look at. The mind-body connection. And mental health is all-encompassing, and I will let you learn how to know when help is actually needed. So you are not alone. The numbers are pretty big. The NAMI website actually offered these sobering statistics, and NAMI stands for the National Alliance on Mental Illness. It'll be on the last screen because it's a wonderful resource. So it says 1 in 5 adults experience mental illness. 1 in 5 in the US. Almost 50% of all Americans will have mental health diagnoses in their lifetime. So half of those will actually develop symptoms by the age of 14. So if you hear a child say, I'm depressed, I'm anxious, I think we should believe them, because that's usually when it starts. Almost 1/5 of youth who are between 6 and 17 years old experience a mental health disorder. And approximately 30% of all mental health issues in the US are anxiety and depression, which is kind of how I prefaced it. So these statistics, were derived from those who actually sought help. I mean, imagine all the people who are braving it out there alone. I mean, who knows what these numbers are? These are probably very small. On the bottom, it says in the US, in 1 year, mental illness will affect all of these different types of people, from Asian adults, Black adults, Hispanic, American Indian, white, multiracial. The one that sticks out for me is the last one, that mental illness will affect 44% of LGBTQ plus adults. And the suicide rate is incredibly high in that population as well because of that. And now, psychological stress. What can this lead to? This is mind body, and people don't realize how connected the mind is to the body. There have been numerous studies on how psychological stress alone detrimentally affects us physically and behaviorally. So this is just it's a sampling of what stress can do to your body. It can cause lack of motivation and job loss, drug or alcohol misuse, overeating, undereating. During COVID, eating disorders among children skyrocketed. Heart disease, irritable bowel syndrome, Alzheimer's disease, diabetes, somatic pains, just pain, these phantom pains that come out of nowhere, and many other medical and psychological outcomes. So I just put two little examples. So this is how it affects you. Physically, if you're anxious, your heart speeds up, you have shallow breathing, among others, you have palm sweat. And then psychologically, you feel overwhelmed with negative thoughts, you have indecision, and this causes you to behave differently. You procrastinate, you have difficulty sleeping, or you sleep all the time. So if you're anxious, it's affecting all of these domains. And then depressed is another example. Your body can feel heavy, and it feels like you're just slugging through, in slow motion. Psychologically, there's a lot of hopelessness, everything's gray. And behaviorally, you can't get out of bed, you isolate, you have difficulty eating and sleeping. So it affects every part of being human. And this is what I was just saying, that mental health affects every aspect of human life. So socially, you might begin to isolate from friends and family, causing relational disruptions, because being social is just no longer pleasurable to you. Your energy is depleted, or you may feel overwhelmed with negative thoughts. So socially, you cut yourself off. Emotionally, you may feel completely out of control. You feel like you're being fueled by your feelings, by anxiety, anger, sadness, paranoia, mania. Vocationally, mental health affects you because you might not be able to concentrate, and you're too unsettled emotionally, to even go to work. If you can't get out of bed, you're not going to go to work. And finally, spiritually, and this one is really hits home for me right now because of COVID. The feelings of loneliness and helplessness can completely disconnect a person from their lives. And, loneliness is actually an epidemic right now. Let's see how to know when to get professional assistance. Everybody is sad at some point. Everybody feels a little crazy, manic, like you can't stop. Everybody feels anxious. But when do you know that you need help? Well, you have difficulties with eating, sleeping, and concentrating, meaning your eating and sleeping habits have completely changed. Either you're getting too much or not enough of either one. Your concentration can decline. And then again, loss of enjoyment. I mean, maybe you start skipping your yoga classes, or you can't work up your desire to read anymore, and you just don't want to work in the garden. It just seems, it holds no pleasure. Changes in normal functioning affects your body, thoughts, behaviors, relationships. So you find yourself actually, like the last slide, physically, you find yourself feeling physically ill. And so your thoughts begin filling with negativity. Your emotions can go from 0 to 10, just like that. And instead of focusing on relationships, you prefer to isolate. And that's just not how human beings are built. You know, we're people. Misusing substances, you will definitely need help. See, some turn to alcohol and drugs in order to escape this pain, and that's their coping tool. However, it's a maladaptive coping tool, and we have better ones to replace it with. And ending the pain may become a recurrent thought. All you want to do is get out of here. It's just too hard to survive anymore. And you know, during COVID, more than 12 million adults in the US had thoughts of suicide. 12 million just had thoughts. And suicide is now the second leading cause of death among youths, ages 10 to 24. I mean, think about that. Suicide is the second leading cause of death for a 10-year-old. The first is cancer. Okay. Now, what is therapy anyway? My wonderful colleague played with this and had all kinds of fun, giving you different points of view. You have group therapy, you have therapy with a child, you have somebody pushing incredible, huge ball of issues. Well, what happens behind closed doors of mental health professionals and their clients? What are we really doing? Well, I'm going to let you know. A mental health professional can help you. What can they help you with? First of all, help you come up with plans for solving problems. And this can be any kind of problem, small to large. They help you feel stronger in the face of challenges because they give you coping skills that you can use. They help you change behaviors that hold you back. You know how sometimes you just keep on doing the same thing over and over and over again, and yet it's maladaptive. It does not help you. Like falling in love with the same type of person over and over again. Why do they do that? Well, sitting and talking with a professional can help you figure that out so that you can move on and break the cycle. They also can help you look at ways of thinking that affect how you feel. Because like I said before, the mind body is so strong. If you think a certain thought, you're going to feel a certain way. And you can begin to heal pain from your past. So that's probably mostly focusing on trauma, which, 50% of people in the US have had at least, one traumatic experience. And then you figure out your goals and build self-confidence. Sometimes people come in just because they're thinking, who am I? Who really is the authentic me? And what is my next step in this life? And what do I want? And where do I go? And this is a place to figure that out and sort everything out. Now, individual therapy. This is a safe place where you can be your authentic self. It is a no judgment zone for the client. It is a collaboration between you and a clinician who cares. And let me tell you something, if they're a good clinician, they really care. And it says me time, which is totally true. And some people can't do that. They don't want to focus on themselves. But this is the time. How often do you get an hour to be fully heard and validated? I can't tell you how many times people leave this office feeling better than when they walked in. And then set times and days to heal and grow. You know, it's usually between, I don't know, 60 to 90 minutes a week. And depending on your needs, therapy can last a few weeks. It can last years, you know, like Woody Allen. He loves it. You decide when you want it to end. It's all up to you. And you see those two low people over there? That's kind of what my office looks like, except I have a bunch of squishmallows, you know, all around. And if you guys don't know what squishmallows are, you've got to talk to a kid from Generation Z. Okay, it's for you. Now we're ready at demystify. The main barriers for getting help, we are going to go over. I mean, if so many people have mental health issues, why the heck aren't they seeking help? So we'll find the main barriers. We'll go over the 9 common myths and we'll bust them. And is privacy protected? All right. I realize this last question is actually central for most people deciding whether or not to get help because, you know, because of stigma, a lot of people do not want to seek out help. People might find out. Barriers to mental health support. So these are some barriers: time and money, transportation, childcare, not knowing how to find help, which now you guys will know, and a lack of providers, which has happened just before COVID because our governor at that time closed down so many agencies and took away so much money that not only did a multitude of agencies have to close, but even now there are funding issues that left some community centers unable to hire the staff they need. Luckily, we're slowly getting around that. So things are looking up. The last barrier is the big one: stigma. Now, while the first 6 barriers can be problem solved, stigma requires a little more focus. So I will turn to this. The discrediting, devaluing, and shaming of a person because of characteristics they possess is stigma. Now, this can lead to fear and shame. I mean, one of the most common reasons people don't seek help is fear and shame. They don't want to be labeled as mentally ill or crazy. Some might believe that they brought it on themselves, so, you know, they'll be judged. Or they're attention seeking. Again, you'll be judged. They fear they might be hospitalized. You know, the fear of facing one's demons may also deter people from attaining the support they need. And the second reason that people don't like to get help is distrust. You know, it's difficult for some people to reveal personal details to a doctor or a therapist. Many express concern about, you know, telling a stranger personal life details. There are cultures that would find this incredibly distasteful. Additionally, people can harbor concerns about privacy. And then feelings of inadequacy. This is interesting because many people feel that they are actually failures if they admit that they have mental health issues. That maybe perhaps they believe people should be able to handle things on their own, or else they might be weak or inferior. Just to ask for help. A lot of people have difficulty asking for help. So they say to themselves, you know, my problems aren't that bad. Other people have it worse. That is just a feeling of inadequacy. Everybody deserves to be helped. And the last is hopelessness. And, you know, again, some people believe that, you know, nothing will help me. I'm just not going to get better. And hopelessness may be due to the actual illness, like depression. And these thoughts can be substantial roadblocks to getting help. There is a young lady in the middle here, bisexual, and everybody is throwing different phrases at her, right? You're just confused. Stop being desperate. Typical millennial youth. You know, it's just like, it's stigma that she's being judged instead of, you know, these people saying, wow, that must be really hard for you to be in this society when you're bisexual. I don't know if you guys know Brene Brown. She's wonderful books. She is a sociologist and a social worker and a researcher on just being human. And I have just like two quotes throughout this, and I really like them. I'll share it with you. This first one is, if we can share our story with someone who responds with empathy and understanding, shame can't survive. So can't be ashamed if people accept you. Oh, I like this one. This is debunking mental illness myths. I wish I had done it backwards, like 10, 9, 8, you know, like David Letterman, but I didn't think of it until this morning. Okay. Number 1, mental illness myth 1. Having a mental illness means you are crazy. Well, this is one of the most common myths. You know, you are not crazy, but dealing with an illness that has challenging symptoms. While the symptoms may skew your thinking and your moods, it does not mean you're crazy. To label an individual with mental health struggles as crazy, I was thinking, would be comparable to labeling anyone with a physical illness as lame. You know, so if you say somebody with a mental health issue, you know, you're crazy. Well, then if you have any kind of physical illness, you're lame. It doesn't make sense. How could you? It makes no sense to me. Number 2, people with mental illnesses are violent and dangerous. You know, the US has had an increase in mass violence, and the media has been quick to judge suspects as being mentally ill. And in reality, hate is not a mental illness. In addition to that, only 3 to 5% of all violent crimes committed by people are those with mental illnesses. Only 3 to 5%. I don't know what's going on with everybody else, and I'm sure it has to do with our society, but they are not mentally ill. 3, mental health struggles are a sign of weakness, character flaws, or low intelligence. Well, mental health problems are not character flaws and have nothing to do with being lazy, weak-willed, or unintelligent. They are actually physiological illnesses. And 4, I love this one. Bad parenting causes mental health issues. You know, you guys, many, many factors influence illnesses of the mind. They include genetics, trauma, poverty, unemployment, and other adverse environmental factors. You know, adolescents from loving, supportive homes can experience mental health difficulties just as adolescents from homes where there's strife. So what I'm saying is that anyone can be affected regardless of their socioeconomic status or how good their life appears to be. I hear this so often where, you know, a parent will come in and say, my daughter wants to come in for help, but, you know, I think she's just craving attention because she has such good grades. She's a straight A student. She has the best friends. She has all these extracurriculars. And you can have depression and you can have anxiety. You know, you can have a lot of different things. And the last here, people with mental health conditions cannot work. Well, yeah, someone with very severe symptoms might not be able to work without special accommodations, maybe getting certain days off if they're not feeling well. However, the majority of people with mental health issues, they can be as productive as anyone else. And, you know, if you're unable to work, there are actually options for financial support, like disability payments through Social Security, which I didn't even know until I did research for this presentation. And more myths debunked. Okay, so only people without friends need therapists. You have a friend to talk to. What do I need a therapist for? Friends are wonderful, and they can be supportive, but not everyone is able to express their deepest fears and insecurities to them. You know, therapy it uses a professional who has structure, is objective, confidential, and non-judgmental. You know, who are you going to open up your deepest fears to? Somebody who is going to empathize, or somebody who knows, they might not be able to take it. It might be too much for them. Everyone with a mental illness needs medication. Well, some people won't need medication to manage the symptoms, while others, meds might be crucial for their recovery. And this is an ongoing discussion to be had with a psychiatrist and the individual. I mean, nobody is going to force you to take anything. It is all up to you. Mental health problems are permanent. Well, each individual's experience is going to be different, right? I mean, some might experience periodic episodes. Others may find treatments enabling them to live meaningful and fulfilling lives. And then some might not fully recover. However, what is the definition of recovery for people? You know, it means different things to different people. For some, recovery is just finding relief from the symptoms, while for others, recovery means they want to be exactly how they used to be. And the final one, drum roll, please. All therapists look like old, judgmental men with gray beards who ask about your mother. Debunked. I am here to debunk that. And there he is, probably good old Freud. Confidentiality. Confidentiality. Now, this goes along with privacy. So you guys will be interested in this, I'm sure. A mental health provider has to keep all clients' information private. I mean, there are some exceptions. And the exceptions include the client poses imminent danger to themselves or another, a judge-issued court order requesting information, suspected child abuse or elder abuse. If you're a minor in therapy, because parents need to know what's going on, it's 12 or under, and insurance purposes, which the insurance actually just needs basic information. They need to know your diagnosis. If there is a possible record review, that would be rare. That would be because, say, you are in some kind of hospitalization program that's very expensive. Well, then they want to know, why is it medically necessary to keep them there? And also professional clinical supervision. And that's what I have. So there are times I'll go to my supervisor for some kind of direction. You know, it's to help the clients. And even then, we don't even use names. So we keep it very, very close. Let's see the next slide. And this goes along with confidentiality. You guys, this is the HIPAA privacy rule. You know, every time you go to a new doctor, they give you this little pile of papers that takes you like 25 minutes to fill out. I don't even know if anybody reads them, but the rule is absolutely fantastic. What it does is it protects the privacy of all your medical records. It safeguards identifiable health information, sets limits and conditions on the use of this information, and individuals have rights to examine and obtain copies of their health records. And also you can request corrections to these records. So, all right, basically, I'll tell you what this is. Basically, the rule is saying that any illness, including mental health, all these illnesses are in your medical record, which is protected by law. It is illegal for your healthcare providers and health insurance to share any of your personal information. Only if the individual agrees to disclose information, say to your family member or another entity, will it be allowed. So you actually have to give the okay for that. And just the idea that you can request to see your records at any time, and you can request corrections. So if you come to see me and I say something that you don't believe is true, or you don't want it in your record, we would talk about it and see what we can do. Change it, delete it, you know? So it's good to know you have rights. The next step, okay, you have been inundated with a lot of information about what mental health is and isn't. So now let's look at the actual mechanics of finding health and what to expect next after that. So this is the last of the 3 goals for today. Direction. So the first is providers and locales. Second, diagnosis and treatment. Then medication, and then affordability. So this looks like a lot of writing. Types of mental health care providers. I'll go through them. And at the same time, I want you to know that most of them are pretty similar. They just have gone through different types of schooling. So the first is a psychiatrist, who is a medical doctor with special training in psychiatric diagnosing, and also the psychotropic medications. So only 2 clinical workers on here can dole out medication. That's the psychiatrist and the psychiatric nurse practitioner, okay? So you need meds, that's who you go to. If you want talk therapy, you look at the rest. Some psychiatrists offer talk therapy, but not often. I haven't noticed that much. A psychologist. Now, a psychologist is a doctoral level professional trained to do therapy and psychological testing. So if you or a family member, you want to know, do I have ADHD? Or is it anxiety? I don't know. So you go to a psychologist and they will offer up a test and talk you through it afterwards, lead you in the right direction. A psychiatric nurse practitioner is a master's or doctoral level clinician who can diagnose, prescribe meds, and provide therapy. Now, either they practice independently or under the supervision of a psychiatrist. So then we have, here you have LCSW and LCPC. They're kind of, there's one in the middle, but what these are licensed clinical social worker or licensed clinical professional counselor, and they're very similar. They're master's level clinicians who can diagnose, and they focus on talk therapy. Now, the licensed clinical social worker also may do management and advocacy. case management. So they're very similar. Now we go to a licensed marriage and family therapist, which is second from the bottom. That's a master's or doctoral level professional who provides diagnoses as well as therapy to couples and families predominantly. The focus is on managing symptoms within relationships. And finally is the associate marriage family therapist. And the last one. And the associate is similar to, I skipped over licensed social worker and licensed professional counselor. All three of these are similar in that they are all master levels professionals who are earning hours face-to-face working in order to attain the second level of licensure. And at that point, they don't need to work in an agency. They can just hang a shingle up on their house if they want. So I fall under that, an LPC, licensed professional counselor. So these are the providers. Now, finding a provider. I think the reason that finding a provider is difficult, other than, a lack of at times, is that we have so many possibilities. I mean, look at all these. You can request referrals from your primary care physician or hospitals. You can contact your health insurance provider for in-network therapies, which is actually the first thing I usually do. Children can go to school counselors, and that's free. You can go to Psychology Today. They have an online directory. You can also just Google mental health agencies near me. And word of mouth. You have a friend who went somewhere and said they were fabulous. Try them out. Now here's NAMI again, the National Alliance on Mental Health. You can call them. You can go on their incredible websites. They are a grassroots organization actually begun by parents of mentally ill children. And its website offers just a plethora of wonderfully useful information, from helping to find a provider and support groups for those who are ill and their families, to a huge video resource library. And they have so many support groups. If you are the individual who has the illness, support groups for you. If you are parents of that person, a support group for you. If you are a friend or family member, there's a group for you. So they're wonderful. They usually meet once a month, and you feel very supported. MHA, Mental Health America, very similar to NAMI. However, whereas NAMI was begun later, I don't know if it was begun in the 50s or the 70s, maybe the 50s, but Mental Health America was actually begun like 1902 by this man who had mental health issues, and he was just trapped in so many of those horrible institutions in those days. And so as soon as he was let out, he began this group, and it's still here today. This one's a good one to know. Look into your work's EAP. EAP is the Employee Assistance Program. So it's a confidential short-term counseling service for employees who need therapeutic support. Especially if they say, the employers say, especially if it affects work performance, which is strange because everything affects work performance. Having a fight with your spouse before you go to work affects work performance. So no matter what, you can go and check out your EAP, see what they have. It is totally confidential, and the employer is not privy to any of the information. And people don't know this. That's why they don't go. But that HIPAA rule, you can call 988 for crisis help. This is new. I think it just began last month, instigated by NAMI. So now, you know, if you have any kind of mental health issue and you just don't know where to turn, you can call 988. It's also considered the suicide hotline at this point as well. You can speak to a pastoral counselor, or you could visit the local health department in your community. Therapeutic settings. Okay. Now, these are based, you know, the way they're listed, they're based on the increasing level of care. So the least level of care is on top and the most is number 8. So teletherapy is newer, and it's preferred by some since it's virtual, meaning that you don't have to leave your home. And that offers even more privacy and takes care of those barriers like transportation issues. Number 2, community mental health centers. That's like where I am right now. Family Service Center is considered a community mental health center. We are an agency within the community open to those who live in this area, the North Shore. So community centers may have mental health interns as well, or sliding scales to aid those seeking financial help. So that is a good little secret. So you can ask for an intern or a sliding scale. Private practice. Now, this is usually a single therapist or a group of therapists who work together. Hopefully health insurance covers them. Otherwise, it can be very expensive. For intensive outpatient program, IOP. So the intensive outpatient program is for those who need more support than just once a week outpatient. Yet they don't need round-the-clock supervision. So often the individual attends a treatment center for maybe 2 to 3 part-time days a week, you know, a few hours, 2 to 3 times a week. And it usually lasts between 3 to 6 months. And again, you can leave whenever you want. If you stay the whole time, that means that's the time that the professionals think would benefit you the most. Partial hospitalization program. That is, they're programs that are intense daily therapies for those who are in crisis. Usually they're 5 days a week. They're for at least 6 hours a day. Time spent may be from 3 weeks to 6 weeks. And they're specialized in particular diagnoses, so you should research online for the appropriate one. And there are PHPs for adults and also for various ages of youth. Children's Lurie Hospital has a very renowned PHP program for children. And then we have inpatient and hospital. Hospitals are the last places that we want to send people. So even if you came into my office and said, I've had suicidal thoughts, we would discuss it and try to use the least harmful way to help you. So if you are in an immediate crisis, say your child is having suicidal ideation and you don't know how to help, you can take them to the ER where they will be assessed and it will be decided whether or not to admit them into inpatient. So While PHP, the focus is on learning coping skills in order to transition back into your life. A hospitalization program is a step up, and it focuses on your safety, and it offers, they can offer medication, change your medication, adjust it. So it's more medical. Usually after you're inpatient, you are then sent to either a PHP or an IOP. So once they stabilize you, then they send you to a program where you can learn skills that you can use in your life. And then residential treatment centers. These are similar to PHPs, excuse me, except the patient actually resides at the treatment center. They are supported around the clock, and stays can range from 30 days to 12 months. And these patients are in critical states with the goal of stabilization. When I used to work with children who had eating disorders, and I was in a PHP program, and we received children who had been from residential treatments. So they stepped up to us. So they were actually at a better weight so that they could get help with coping skills. But, we wouldn't have the equipment for that. And the last, substance abuse treatment centers. These centers offer rehab for substance abuse disorders, and the length of stay could be 30, 60, 90 days. And the average is at least 2 stays to become sober. It's very difficult to go through it once and then be healed. What does the first appointment look like? This is fun. So here you see, again, my colleague fun pictures. There's a waiting room and the therapist room, confidential. So here it says confidentiality, client's rights, informed consent. So you learn all about that. You learn about the expectations that you will have for therapy, maybe the expectations that you have, and you discuss those with the therapist who says, these are realistic expectations, and they tell you the expectations that might arise from that. You talk about why you chose therapy. What are your issues? What are your symptoms? What coping skills do you know? I'll teach you things that you don't know. Do you have a diagnosis when you come in? Otherwise, we'll give you an initial diagnosis. And then we'll go through different types of therapy and what we do. And we answer all your questions. I mean, you're probably wondering, do I have to lie down on a couch and talk about my mother? Will the therapist sit behind me writing a grocery list while I talk my heart out? Will I have to be in therapy forever? No. The answer to all those is no. The therapist will come out and greet you. And once in the office space, it'll be like having a conversation and seeing a doctor at the same time. You'll be asked many questions, like I went through on the slide, about your concerns and history, expectations, and the therapist will explain your rights. Now, this is an interesting area, because some people are nervous about being diagnosed because they're afraid it will label them, which is why as therapists, we don't necessarily use diagnoses other than leading us to the direction of the correct treatment. So the DSM, Diagnostic and Statistical Manual, we are on number 5 right now, and I think 6 is coming out pretty soon. The DSM is this huge book of diagnoses that clinical professionals refer to, just in order to streamline diagnoses across states and countries, so that a person a therapist in Brooklyn can speak to a therapist in Nova Scotia and understand what they're talking about. Diagnoses capture presenting issues and provide a shorthand communication tool. So, which is pretty much what I was saying, that it's a shorthand to talk, to say, my patient, I think, is depressed. In a Nova Scotia, they'll say, well, what are the symptoms? And look it up in the DSM. It's also diagnoses. The DSM is a tool to determine treatment options. So if you have bipolar, and if you have, a narcissistic personality disorder, it's totally different treatments. And knowing approximately what your diagnosis is helps that. Insurance requires a diagnosis just to cover the expenses. So they just need a diagnosis to know that it's medically necessary, and we'll cover it. This is a big statement, actually. It may take time for accuracy. It's important. So a mental health practitioner makes the best diagnosis that they can with the information they have, when you first walk in. But over time, the diagnosis can be refined and changed. Diagnosing is difficult. It's a difficult practice, and it can cause relief that, oh my gosh, now I know that it's something, I'm not crazy. I have an illness that a bunch of other people have. Or it could cause grief. And you say, I don't want to have that illness, and it may take a long time to uncover true diagnoses. And that's why different practitioners may arrive at various diagnoses. So when you see somebody and they say, oh, you definitely have depression, and you think, wow, I have depression. I don't really feel that depressed, but okay. And then you go to somebody else because you want a second opinion, or this person doesn't click with you. And the next person says, no, it's not depression, it's anxiety. You have anxiety. And then you'll say, that feels more like it. Yeah, I have anxiety. Anxiety is causing me not to sleep, not depression. So, you have to kind of look around. You have to follow your gut as well. And it may provide relief, I spoke about. And medical doctors and talk therapists can also diagnose. So I can diagnose. You don't have to be a psychiatrist. Okay, getting towards the end. We only have 5 minutes. I will just breeze through a couple then. This one I was going to breeze anyway, because these are just types of treatments. Maybe you've heard of them. CBT, DBT, EMDR, ERP, all these wonderful letters of the alphabet. Family therapy, couples, individual, group. There are over 400 different types of therapies. The ones I put up are evidence-based, which you will see ever so often. And that means that there has been a lot of research put into these towards their effectiveness. But we can pull anything out of our toolbox that the client might need. And the medication mystique. Medication influences your brain chemicals. It doesn't add chemicals to your brain. It influences chemicals that are already there. We make serotonin, dopamine, acetylcholine. I mean, we make all these. So what the medication does is it enhances your brain with the absorption or non-absorption of these neurotransmitters. Medication can manage your symptoms, and everybody responds differently. If you say, oh my gosh, You tell your best friend, Prozac works for me so well, you got to try it. And the person tries Prozac and they feel ill. You know, our bodies are made differently. It may cause side effects. If the side effects are too much for you, I mean, often they go away after two weeks, usually, I think. However, if they don't go away, you have to see if that's the right med for you. And it also may be a life changer. And it will not change your personality. Trust me. All right, almost at the end, the bottom line, paying for treatments. Okay, there's insurance. You can pay out of pocket. You can ask for a sliding scale, EAP, schools, drop-in centers like the living room at Turning Point is a place for crisis. If you're just having a panic attack and you just want to talk to somebody, you drop in. And then there are prescription savings cards for medication. But this is a secret I want you guys to know. Go to the manufacturer's website. It's amazing. You can get months worth of medication for $25. That's usually hundreds of dollars. So definitely do that. And here we have references. I've mentioned a lot of these. And I can give these to Pam, or you can see them online when she puts it up. So here are some local agencies around here. You know, us, Family Service Center. You have Youth Services, Jocelyn, the Living Room. And then again, you have NAMI and Mental Health America and 988. The Trevor Project is for LGBTQ people. SAMHSA is substance abuse and mental health. There's a national helpline for referrals, and NAMI also offers referrals. And then Psychology Today, again, has a Find a Therapist that you can go to. And then there's another quote here that says, only when we are brave enough to explore the darkness will we discover the infinite power of our light. I like that one. And then we have questions. That's a lot of info. And you guys are still here. So hooray. If anybody has any question of any kind, I can try to answer it. And if I don't know the answer, I can look it up for you.
May I offer a couple of points, please?
Oh, absolutely.
First of all, how do you know that the therapy you're going into is based on science? I'm thinking in terms of something like Jungian analytical psychology steeped in mysticism and the occult. Chiropractors who are quacks and unethical some of them offer psychological therapy. How do you know that you are getting legitimate scientific support help?
Mm-hmm. Mm-hmm.
The other point, if I may, just to get them both out of the way, it's almost impossible to get an appointment. Can you address that point?
Mm-hmm. Good questions. And it sounds like you might even be a little frustrated. So I like that.
A little? That's
a little?
Understatement. That's an understatement.
Really?
Yeah.
All right.
This has been going on for years.
Oh my gosh, I am so sorry. That's horrible.
Yes.
Okay. I'll answer the scientific support first. When I put up that one screen, the slide that had CBT, DBT, EMDR, they had a whole bunch of different modalities of interventions. And what you can do is when you go online and look up different agencies, they always have conversations about what they use. And so often they'll say evidence-based. We use evidence-based treatments. So if you really want to focus on that, that's what I would look for. There are, like I said, there are over 400 different types though. And just because the 400 different types aren't evidence-based doesn't mean that they won't work for you. You know, like there's expressionistic arts therapies, which I don't think they're considered evidence-based because, you know, we as therapists don't really like doing research. We like talking to people. But if they did research, I know they would find good things because the outcomes are really good. But just look for those words, evidence-based, and that should help you. And then for the appointment, oh, and also I just want to tell you with evidence-based, if you see a therapist and they're using some modality that you just don't like, you don't have to stay with them. You know, you guys can find whoever you want. There are other people out there.
That gets to my other point. You can't find somebody to begin with.
Right. So appointment. Remember when I said that right before COVID, not all, but so many agencies were shut down. And so slowly they're coming back and building up. So we're definitely hoping as a science to create more avenues for you guys to use. It is difficult, and you know what? Keep looking, because like with my kids, I told you, I couldn't find anybody that Blue Cross would support that I liked. I couldn't find anybody. And so I decided to just start Googling all these places. And I said, do you have sliding scales? Places I'd never heard of. And we went. And I ended up finding some good people. I mean, if they say, yes, I was put on a waiting list with them for one time, it was a year. And that was during COVID. And that was horrible. So I totally empathize with you. But I think it's better now. Like right now, Family Service Center, we don't have a waiting list. So come on over. I would just say keep trying, because we are building up again. It is a shame that this profession has taken such a beating, you know. Yeah.
I just wanted to make sure people also got in their questions. There was a question about pursuing volunteer opportunities. Does Family Center have any? Or
volunteer opportunities. I could look into that. I'll take down your name and see if there's ever something that we could offer. That's really sweet. That's a neat idea. And you know, NAMI also has needs volunteers, as well as JCFS, the Jewish Child and Family Services. They use volunteers. Yeah, you can call different agencies. Yeah. Mm-hmm. That's really nice. Be involved.
Any other questions from the group? And I can also give you Alyssa's contact information if you have any further inquiries or follow-ups.
I had a really, go ahead.
Repeat the name of your organization. It's the Family Service Center, is that correct?
Correct. Family Service Center.
Yeah. Is it better to phone or contact online?
Oh, call us.
What is the number, please?
Yeah, and we're in Northfield. Are you in the North Shore area?
Yes.
Oh, wonderful. So call the main office, which is 847-251-7350.
251-7350.
It's up there now.
Thank you.
And I put in the chat, and it's on that screenshot. I also put in the chat if anyone wants to download that.
Oh, good.
That whole slide I quickly put in there. So
thank you.
Yeah.
Okay, we're going to close out just because of time, if that's okay. But hopefully you have some good references. Alyssa, thank you so much.
You're so welcome.
This is amazing. I found my healthcare provider through my doctor, but that was a whole long process for me. But finally my doctor just called her friend. So it's like, and that's been magical. So it takes time sometimes to find the right person. I agree with that. Thank you so much, Alyssa. I actually learned a lot too.
Oh, good.
It's making me feel okay with myself too. So thank you.
Oh, of course.
Awesome. So thank you so much for today's program. We thank you on behalf of the Y. A special thank you to Alyssa and the Family Service Center. Programs like this are free and open. Check us out online at the nsymca.org. Our next talk is next week, next Wednesday at 7 p.m., joint, spine, and nerve pain, brought to you by IBJI. So if you don't want to take pills for your pain or surgery, come to that talk. So
don't miss that one.
Thank you so much, Alyssa.
Yeah. All right. Thank you, everybody, for showing up. Thank you, Pam.
Okay, bye.